Assalamu alaikum. I am Dr. Mohammad Ehsanul, Associate Professor of Biochemistry at the Akij Medical College, Khulna. Today I will talk about the basic principles of clinical enzymology. What is enzyme? Enzyme is a biocatalyst which is produced by living cells, and they perform various catalytic functions inside the cell. And clinical enzymology is a study of the estimation of enzymes and using this knowledge to help the doctors manage the patients better. Now, where are these enzymes present in our body? These enzymes are present inside the cell. In fact, all the cells in our body can produce all the enzymes, but the enzymes are expressed only in those cells which requires them the most. For example, amylase and lipase, these are the enzymes which are very important for the digestion of carbohydrate and lipid, and these enzymes are present in pancreas. ALT and AST, these are the liver enzymes, and they are present in the hepatocytes. Similarly, creatine kinase, aldolase, these are present in the muscle. Now, enzymes are supposed to remain inside the cells. How do they come out into the blood? Ideally, the enzymes are supposed to be inside the cells, but when the cells are subjected to various injuries or inflammations, these enzymes come out of the cell into the blood. And these enzymes in the blood do not have any specific functions. That's why they are called non-functional plasma enzymes. And after some time, when the inflammation or the injury subsides, the enzyme level come into normal. So that means the cells are getting healed. So this knowledge is very important, and this is the basic principle of clinical enzymology. We have to know which enzymes are the specific for the specific tissues. For example, amylase is present in pancreas. So if we are looking for the injuries to the pancreas or inflammation of the pancreas or pancreatitis, then we will look for the amylase enzyme. But in this case, if we use lactate dehydrogenase for the estimation, for the diagnosis, it will not be a good marker. Why? Because lactate dehydrogenase is increased in the injury of all the cells in our body. So it will not be very specific for the pancreas. So this knowledge is very important when dealing with the clinical enzymology. So which are the enzymes that present in which tissues? Pancreas contains amylase and lipase. Liver contains ALT and AST. Then bile duct contains ALP, alkaline phosphatase, and gamma-glutamyl transferase. Muscle contains creatine kinase. Also, our heart contains creatine kinase as well, but the MD fraction of the creatine kinase. This is an isoenzyme of the creatine kinase. Now, isoenzyme is another important topic, important term for the clinical enzymology. What is an isoenzyme? Isoenzyme are the enzymes which have the similar properties or the functions in the cell, but they are different in the structure. So, structurally they are different, but functionally they are similar. For example, creatine kinase has three variant isoenzyme. One is MM, one is BD, and one is MD fraction. So, the MM fraction comes from the muscle, the BD fraction comes from the brain, and the MD fraction is predominantly present in the heart. So, this knowledge of isoenzyme is also important. Alkaline phosphatase has multiple isoenzymes. One variant of alkaline phosphatase is present in the bile duct. Some alkaline phosphate is present in the bone. Some are present in the intestine. Even some are present in the placenta as well. So, if a patient comes to us with a jaundice and hepatic problem, I might go with the alkaline phosphate. So alkaline phosphate alkaline phosphate level might be increased in the jaundice and hepatic disease. Also, if a person had a bone fracture recently, and we might get the elevated level of alkaline phosphate as well. Even the children who have going through the developmental phase also have the elevated level of alkaline phosphates. And if you take a blood sample after the meal, the alkaline phosphatase level will also be increased because it is also present in the intestine. The pregnant ladies will also have elevated level of alkaline phosphatase. So it is not the rise of the enzyme level which indicates a cell damage. You have to take the context into consideration. It is absolutely imperative to have this knowledge for the better diagnosis. So this is all about today's discussion. Hope you have got a good idea about the clinical enzymology. Thank you.